So today we're diving into the world of frozen shoulder, what it is, why it happens, and most importantly, what you can do to regain your mobility and to reduce pain if this is something that is going on with you. So even if you don't have frozen shoulder, but you're struggling with limited range of motion, so say you have a rotator cuff injury and you're having discomfort and stiffness in your shoulder, then this live stream is for you. And maybe you know someone that is really having a hard time with this. Please share the replay with them. You can tag them below, and you can also share the replay with them. So in this live stream today, we're going to explain how the shoulder joint works. I'll highlight a few mistakes that people often make when it comes to treating frozen shoulder. And we're also going to cover a few of the most common myths when it comes to frozen shoulder. And I'm going to give you some really practical yet powerful exercises and techniques that you can use today that will help you to ease the stiffness, increase the mobility, and reduce the pain and inflammation so that you can take the first steps to regaining full range of motion. And we're also going to talk about some of the deeper reasons of why this may not be healing if this is happening for you. So let's go ahead and dive into it now. And if you are joining me today to go over some of the exercises we're going to be doing, they're not going to be the normal frozen shoulder exercises. Those are helpful. I do teach those to my clients and they do work. But what we're going to be talking about in this live stream today, it's going to be different than like the pendulum arm swings that you may have learned, or the, wall crawls with your hand. We're going to be going into some techniques and some exercises that you may have never heard of. So make sure you stick to the end, because I'll be doing those techniques at the end of the live stream today. And so if this is going on for you, I just want to say my heart goes out to you. I know how frustrating this can be when you've lost range of motion in your arm, especially if it's your dominant arm. And when, even very simple tasks like reaching for something on a shelf become so challenging and even impossible. And this can go on for years, right? I mean, some people actually never regain full range of motion in their arm, unfortunately, and can never lift their arm all the way up overhead. So we're going to talk a little bit about why that might happen, and why that's going on. And I know if you've tried a lot of different things, it's easy to feel like your progress is too slow or that the stiffness will never go away. But I promise you that it will, that you can get better, but you definitely don't want to just ignore it. That can be one of the worst things that people can do. And that's one of the myths about frozen shoulder, is I should let it rest, or I should just kind of not use my arm because it hurts. And that's one of the worst things that you could do for frozen shoulder. And I'll get into that in a moment and explain more about why that is. But I wanted to share a case study first. My client Sally came in to see me for frozen shoulder, and she had been doing a lot of physical therapy, but it just really still wasn't helping. And she just couldn't get her arm up past that 90-degree angle and regain full range of motion in her shoulder. And she was also told to be just working really hard at these exercises, doing them many, many times a day, pushing through the pain that she was experiencing. And she was just really frustrated and kind of over it because it wasn't working for her. So when she came to see me, through gentle, consistent movement, stretches, and doing the exercise homework that I gave her, which was also to avoid pushing through pain, she was then able to reach overhead again and achieve her goal within a few months. And one of the key things that we also worked on was, her mindset and being able to reduce her fear of movement and retrain her brain and that body connection that it's safe again to move and that she can and will be able to move without pain again. Because if you have been in pain for so long, it can sometimes be hard to even imagine, how am I ever not going to have this? How am I going to get out of pain? How am I going to regain mobility and range of motion when nothing's working? And so that was one of the things that we worked on, was being able to shift that mindset to realize that she could achieve her goal and to actually be able to visualize herself achieving that goal and being able to lift her arm. And so we're going to get into that a little bit later on. But first, let's talk a little bit about what frozen shoulder is, because if you don't have this going on and you just wanted to tune in today because maybe you have a friend or a family member that has this, I'll quickly explain what it is. Frozen shoulder is also called adhesive capsulitis. So the joint capsule in the shoulder is made up of connective tissue. And what can happen there is that connective tissue can kind of fold like an accordion, and that creates those adhesions, which is why it's called adhesive capsulitis. Anytime you see itis at the end of a condition, that generally refers to inflammation. So it's an inflammatory condition, but it's only inflammatory in the first phase of frozen shoulder, the freezing phase, and I will get into that more in a second. But what happens with frozen shoulder is, your arm is frozen, so it's hard to lift your arm. Generally, you start out not being able to lift your arm much past, your hip or waist level, and then over time, you get more and more mobility. Maybe you start to be able to lift your arm up to 90 degrees. But a lot of times people get stuck there because there are certain muscles involved when you are lifting your arm past this 90-degree angle to get your arm up here. There are a number of things that need to happen with the rotator cuff muscles and tendons to allow you to lift your arm up past 90 degrees. So even my father, for example, recently or a few years ago had a shoulder replacement. And he had a PT coming to his house to help him with the exercises. So he started feeling a little better. But then the PT stopped coming, and this is really common. He stopped doing the exercises, didn't get better after that, was never able and still cannot, years later, lift his arm past 90 degrees. And he may now never be able to do that because it's been so long. And this is why you want to address this right away so that that doesn't happen, and that you are able to get that, that mobility and that movement back, okay? So why does frozen shoulder happen? Well, really, the medical community will say it doesn't really know exactly why it happens. I have a couple of my own theories about that, but it can be triggered by an injury, like you fall on your shoulder, it doesn't heal properly, or maybe like my father, you had a surgery, it didn't heal properly, and a period maybe of immobility where you weren't moving your arm. It's more common in women than in men, and it's most common for women during their, their menopause years when they're having hormonal shifts. And that's why it's sometimes called 50s shoulder for that reason. It's also common for folks that have diabetes, an autoimmune condition, or a thyroid condition. So I'll tell you a little bit about what I've learned working with clients. I've worked with clients in a rehab fashion for 12 years. And before that, I was teaching yoga and doing yoga therapy for 20 years. So in my experience, what I've seen with my clients is they all have one thing in common. And that one thing is that they have a lot of adhesions in this muscle right here. So that muscle is, let me see if I can get a better view in the camera. It's like the top of your shoulder, but it's not the upper trapezius. So the upper trapezius is this muscle that I'm using to elevate my shoulder. The supraspinatus is right above the shoulder blade. There's like a little groove or dip that the muscle actually sits in. And it's the supraspinatus tendon goes down in here. So it goes under the acromion process of your shoulder. And that tendon needs to slide under the acromion process to get your arm above 90 degrees. Okay. Now, so actually, let me finish explaining that. So if there is adhesions on that muscle, which is very, very common because how many of us have tight shoulders up here? The upper trapezius is the most commonly known muscle when it comes to tight shoulders, but it's not the only one. There's also the supraspinatus, which is a little bit behind it. And you can develop adhesions, scar tissue, and calcification on the tendons. You can have a tendonitis that has calcium deposits on it, which you can feel in there because it feels crunchy. Okay, so we're going to go over a self-release technique that you can do on your own to release that muscle. But I just wanted to explain this first to give you a better understanding of why this may be going on. And this is also more common for women because men generally just have more muscle there in their shoulders. And because of that, that muscle helps to stabilize the shoulder joint. Okay, so if the shoulder joint is not stable, what's the most common pattern that we see as a result of that is the shoulder rolls forward in the socket. Okay, we all know, that most of us hunch our shoulders forward throughout the day, whether we're working on a computer, driving. It's very easy these days to have poor posture. Really have to work on it, right? To get out of our devices and to sit up straight and open the shoulders back. So the shoulder joint is like a golf ball on a tee. So if you think about a golf ball that's resting on a tee, how small is that articular surface? It's very small. If a big gust of wind came by, it would blow the golf ball off of the tee. So that's what your shoulder joint is like. It's a very small articular surface. It's a ball and socket joint. So we're meant to have what's called circumduction of the joint, full circular movements there. But as you can imagine, if the golf ball is just even like a millimeter off of that tee, it's going to throw everything off and it might, fall off of the ball. And it's the same thing in your shoulder. If your shoulder's rolling forward, it's sending the head of the arm bone forward in the socket. And then that makes it really hard for the rotator cuffs to do their job because the rotator cuff muscles have this very specific timing where they work in synchrony with each other. If that timing is off by even a small micromillimeter or degree, then it's going to make it really hard for you to lift your shoulder. You can even do it now. So if you are able to lift your arm, you can try this now. Roll your shoulder forward, try to lift your arm. It doesn't feel good, right? And it's almost impossible to get your arm up here 180 degrees. So that's why this is important. And that's why we want to address posture. We want to address tight shoulders, all these other things. There's also some emotional aspects to this that we're going to get into a little bit later on. But I just wanted to explain that anatomy first, because I think that sometimes when you're able to understand the anatomy, then that can make it much easier to get a better sense of what's going on. Okay, so if you are jumping on this live stream today, feel free to drop a comment below and say hi. Let me know where you're coming from and if you are relating to what we're talking about today. And there will be an opportunity at the end to also ask some questions. Feel free to ask now in the comments below if you just want to pop that there in the chat, and I will get into that in a minute, okay? So So, let's talk a little bit about the mistakes that people often make when it comes to treating the shoulder, frozen shoulder. So, one common misconception about frozen shoulder that I've heard a lot of people tell me their, medical professional or their physical therapist told them to do, which is to push through the pain. And, pushing through pain has a time and a place. I'm not saying that that's always a bad idea. Um, but when you push through pain, you're sending your nervous system into a fight or flight state. Your body's telling you, please don't do that. That really hurts, but you do it anyway. And that creates a sense, lack of safety in the body. And so if you're already maybe feeling a little bit out of balance, a little hypervigilant in your system through stress, then that's not always a helpful signal to give to your body. It doesn't always help to support the healing process. And so I've really found some gentle techniques that work for treating frozen shoulder. And then it's really up to you. If you want to experiment with pushing through the pain, see if it helps, see if it works for you. Everyone's body is going to be different. So there's not one exercise that's going to work 100% of the time for 100% of the patients out there that are struggling with this. So you do want to trust your intuition, okay? And, I know it's tempting to force your shoulder to move, but, this can also worsen the inflammation. So what I recommend is sticking to gentle, pain-free ranges of motion, okay? Another common, myth that is out there is that you shouldn't move your shoulder at all. It's hurting, don't move it, rest it, don't do anything at all. So complete immobility can definitely worsen the stiffness. So you want to find a balance of gentle movement, which is key, because one of the reasons why this might be happening in the first place is lack of mobility and lack of movement, because our shoulders were designed to move through these full ranges of motion, not just once a week, but all day long. We were meant to be climbing trees, hanging from our arms, having our arms overhead to hang laundry, doing things like that. And so when we don't move our arms in that way, and especially if we are on a device for a good portion of our day and our arms are in front of us here like this, then that's only one range of motion that our shoulder is able to explore and experience throughout the day. And how many of us have our arms back here throughout the day, right? So one of my teachers, who's also a physical therapist, said that as we get older, and hopefully this doesn't happen for any of us, but if we are going towards having a walker, our arms are going to always be here, right? Most people don't have walkers back here. So we want to work on this full range of motion in our shoulders so that we can maintain the mobility, the flexibility, stability, and strength that our shoulders need. That recipe of those four things: flexibility, stability, mobility, and strength. Okay? All right. So let me know if you're popping on here and you have any questions about any of the things that I'm getting into today. Nice to see you here, Sonia. Thanks for joining me, and just let me know if you have any questions about what I'm going over here today. So let's get into the idea of, do I ice or do I heat? I know a lot of people are often confused about this when it comes to any kind of pain, really. It can be complicated, but especially when it comes to frozen shoulder, okay? So frozen shoulder goes through 3 stages. If you have this going on, you're probably already familiar with this, but I'll break this down just in case you're not. So there's the freezing stage, which is the beginning stage, then frozen, and then thawing, okay? And these stages take maybe anywhere from like 6 weeks to 9 months, right? So each stage could take 9 months. It really just depends on your body, what's going on, but it mostly depends on what treatment you're doing. I think that's the number one thing for any injury is, are you doing the right recipe of exercises, of treatments for your body, and are you getting to the root cause? Okay. So during the freezing stage, it's crucial to minimize the inflammation. So that's the inflammatory stage. Okay. And then after that, it's no longer an inflammatory thing. And so icing would be important in the beginning when you're in that freezing stage. And usually you know that because that's when you're experiencing the most pain. So ice can be really helpful for that in the beginning to reduce that inflammation. And then after that, once you get into more like the frozen and thawing stage, then you can start to move towards heat because then it starts to become tight muscles, stiffness, immobility. And that's where you can use heat to help to reduce some of that muscle stiffness, okay? So another thing that I suggest doing is an anti-inflammatory diet, and this looks different for everyone. So in my Thrive Beyond Pain program, I recommend a 30-day anti-inflammatory cleanse. And we do a deep dive into what that looks like and how to do that so that you can be supported and really have your hand held throughout the process. But we also really do it in a shame-free way because when it comes to food, a lot of us have been taught to shame ourselves around what we're eating, to have negative self-talk around not just what we're eating, but around our bodies. And so our, relationship to food is also just as important as what we're eating. So we also go into that. But if you're struggling with frozen shoulder and you haven't tried reducing the inflammatory foods in your diet, this is processed foods is number one. And then sugar is on the top of the list. So if you haven't tried this before, that would be my suggestion, is starting with reducing processed foods and sugar. Those are the main ones. And then we go more into detail about all of this, everything you would need to know in my program, okay? So let's get into some of the exercises, the techniques that I recommend for frozen shoulder that you may have not heard before. Okay, so first one we're going to be doing is self massage for the supraspinatus. It's a tongue twister. Supraspinatus muscle. I showed you earlier where that was. In case you missed that, we're going to go over it again. So that muscle is right here at the very top of the shoulder, but it's different than this upper trapezius muscle, which is right there. It's kind of behind. And its job is to lift your shoulder to about there, right? So that's its job, lift your shoulder to about 70 degrees. And so if you put your fingers in that little dip there, there's like a groove right above your shoulder blade. You might feel it firing and turning on. Okay, so what we're going to do is a little self-massage. We're just going to dig our fingers right in there. You could always have your friend do this. Unfortunately, I've never been to a massage therapist that knows how to work this muscle. You may have a great massage therapist, and if you do, I'd recommend going to them and getting this muscle worked on. When I do manual therapy on my clients in person, I almost always get into this muscle because it's almost always tight for folks. So what you want to now do is go to the end of the muscle where you have the tendon. It's your supraspinatus tendon. Okay. And you're going to just dig in there. I can feel it there. It feels a little thickened for me too. So that's the terminology we use when a tendon is thickened, then you can feel it. And that's going to definitely affect that tendon's ability to slide under the acromion process in order for you to lift your arm, okay? I didn't do any anatomy slides today because it's a lot to be doing all of this and the slides. But if you're interested in this, I could do another video where I go more in depth and I show some slides about the anatomy. Okay, so but what we're doing now is just massaging that muscle all the way down to the attachment. You'll feel kind of a bone there. You may feel some crunchies in there. You want to get into those crunchies. So obviously you're going to do this on the side where you're experiencing frozen shoulder, but it can be interesting to do also both sides as well. Get in there and just, it's also interesting to feel, you know, you'll have frozen shoulder on one side, but not the other side. And what unfortunately happens quite commonly is that folks will get it on one side, and then because they're just doing all of the work with this other arm and shoulder, then when this one heals, this one goes frozen. So you can avoid that by doing what we're talking about today. Self-massage is really helpful, not only because it helps to release the tight muscle and work out some of the scar tissue, the adhesions, calcium deposits, things like that. It's also going to help to improve the blood flow, which can help to reduce the inflammation and support the whole healing process, okay? So you can keep doing that on your own if that's feeling good, but I'm going to go on to the next one in the interest of time. We're going to work on the joint capsule, okay? So what you're going to do is you're going to go and find the pec muscles here. So the way you can find that is you have like the head of the shoulder, right? That's your humerus bone. But if you go 2 to 3 inches in medial to that, you'll feel your pec minor. And you can dig around in there and then see if you can kind of sink into those tissues a little bit. This can be nice too, doing this like in your bed before you go to sleep at night, especially if you're feeling a lot of pain and when your shoulders kind of relaxed in a pillow or something, then that can be also a nice way to do it. As you're doing this, if you are able to move your shoulder back, then you can add some shoulder mobilization, unwinding the joint back, because again, shoulder wants to roll forward. So in our treatment, we want to roll it back this way, okay? Great. And so now we're going to do this exercise. I call this the chicken wing arm. And you're just kind of, you put your fingers here because obviously you're probably not going to be able to go up here, right? So most people can do this with frozen shoulder. And then you're just going to lift your arm only as high as you obviously can, not forcing it, and doing a small circle, okay? So it's like you're drawing a circle with your elbow. And if that doesn't feel good, you could try it this way with your arm down. But I feel like doing it this way gives you a little bit more that circumduction in the shoulder joint, okay? All right, well, how is that feeling? Hopefully that's warming up the tissues and softening up the tissues a little bit more, okay? So what we did there is we released the supraspinatus muscle. We got a little bit into the front of the shoulder, the pecs, the pec minor, and we can actually get into some of those folds in the shoulder joint. Sometimes that takes deeper pressure than we're able to do on our own. So one thing you can try is if you have a massage ball, a tennis ball, a lacrosse ball will work as well, then you can take that ball right there and do that on your own, okay? So meant to move that hat, but I forgot. So you're gonna put your shoulder right here and you're just gonna lean into that ball. And you'll notice where it's tight and where it needs it. Now you do want to be careful there because there are nerves. You have all of the nerves that travel through your thoracic spine and through that brachial plexus there. So, you know, if you're feeling a lot of like tingling in your fingers or any kind of nerve pain, that means you're in the wrong spot. You maybe want to explore a little bit more and move around. But that's another way that you can do it. And you can also get up here, like I was saying, into that supraspinatus muscle. I'm going to show you how to do that It's gonna be a little funny to see if I can figure this out with the camera here, but let's try it. So you would want to do it in a door frame, okay? And I'll show you over here my door. All right, so hopefully you were able to see that. So what I did there was I kind of was leaning forward. My torso is as horizontal as I can get it, and I have the ball there, and I'm kind of putting the pressure forward into that shoulder area. So that's another way that you can do that self-massage. Okay, and there's lots of exercises that we can do for frozen shoulder. And when I work with my clients, either one-on-one or in my groups, we go over a lot of those mobility exercises because doing some stretches with gravity, like on a foam roller, that can be really helpful. There's TheraBand exercises you can do. You can do exercises with weights, like the pendulum one. So this would make this live stream much longer than the time that we have today if I was to show all of those exercises to you, but I just wanted to show you the ones that might be a little less common that you can't just like go on YouTube and find. And hopefully if you have frozen shoulder, you're not going on YouTube to find your treatment because everybody needs something a little different. That's why it's helpful to really work with somebody that knows what's going on. And if this is you, I'm happy to chat with you about what I do. You can comment frozen below and I will reach out to you and we can chat a little bit more about your situation, what's going on with your shoulders, and see if I can possibly help with that. Okay, so the last thing that I wanted to cover was the concept that I introduced in the beginning of the live stream when I was talking about my client, Sally, who was able to improve within 6 months, even though she had been to PTs and she had done other treatments that really weren't helping her progress as quickly as she wanted to. And one of the things that we did, in addition to exercises and stretches, was we did some visualization techniques so that she could trust her body, that her body knows what to do. Her body knows how to move. Her arm knows how to come up to her ear. That's how our bodies were designed. Our bodies are these beautiful self-healing, self-regenerating mechanisms, and we have this healing power within us. And sometimes we just have to remember that and tap into that innate ability to heal. So what we're going to do now is just a quick visualization to experience that within our bodies. And research has shown that when athletes or dancers use visualization before a big competition or performance, that it really helps them to achieve their goal. And when I was a dancer, before I really even knew much about all of this, I would use this technique. Somewhere somebody had told me that I should try to visualize myself in the performance, doing everything perfectly, not forgetting the choreography like I usually would, not messing up at all. And every time I did it, it would work. So we're going to go ahead and do that together for a moment. So if you can just kind of find a quiet place where you can sit down and there's, no one distracting you. You can have a quiet moment to yourself. I want you to start by taking a few deep breaths. Breathing in through the nose and exhaling out the mouth. Very nice. And then I want you to just start to visualize, imagine yourself doing whatever you feel like you're not able to do right now. And even if you're not struggling with frozen shoulder right now, but it's something else, see yourself doing that thing, that activity that you would be able to do if this pain wasn't limiting you. So if it's frozen shoulder, you can visualize yourself lifting your arm up overhead. Maybe your hanging from the monkey bars with your kids. Maybe you're climbing a tree, or you're just able to cook a meal without your shoulder hurting, and you're able to reach and grab for a can from the shelf without pain or immobility. So take a moment there to visualize that. Really feel it in your body. Engage all your senses. What do you notice in this imaginal scene? Where are you? What are the colors, the smells? Engaging all of your senses, really bringing yourself fully into this moment. Wonderful. You can gently open your eyes, come back into your space. I like to just end that with a little orienting practice, orienting to the environment, just to bring yourself back to your surroundings. So you can just notice, looking around, seeing what's in your room, you're in the space. Beautiful. So this is a practice you can do anytime for any condition. I highly recommend this. I know it's worked for me and for my clients as well. So I hope that this live stream was helpful today. If this is something that's going on for you, definitely try those self-massage techniques that I showed you, and also try this visualization technique, because if you've never tried this before, it may feel kind of silly, but that's okay. It works. You can do it anyway. So I would love connecting with you if you want to learn more about the way that I work and what we do in my Thrive Beyond Pain program, where we're able to work on these specific conditions. Because we start the program with an in-depth health and movement assessment, where I give you this assessment to fill out. It's very in-depth. It goes over all of your past injuries and everything that's gone on with your body, and we go over your goals. Where do you want to get? Where do you want to be in 6 months? And then we do a one-on-one session together. Then after that, in the group, we work on all of these exercises together. And what is so supportive about being in a group is that you're all there for each other. So, if you're having a hard day and one day you're just experiencing a lot of pain, you're not sure what to do, you can jump on the private Facebook group and write a message. And there's usually somebody that can just pop on there right away, whether it's myself or somebody else, that can really show up to support you on the journey. And so we're meant to do this together. We're meant to heal together and to support each other. And so, especially if you're in pain and you're just feeling alone, or like nobody really understands what this is like, everybody else just seems to be fine. Nobody's struggling with this like I am. I know how that feels. I've been there before. And I've also joined programs that really supported me and helped me in that way on the journey, to have a community of folks that I can really lean on, to find some of that camaraderie and support. So if that's interesting to you, you want to learn more, then you can comment support below and I will reach out to you.